Chief Pharmacy Officer for Baptist Health, and Dr. Marie Rossique, a Pediatric Clinical Manager for Baptist Health, are standing by and ready to answer your questions on this episode of Ask the Doc.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Welcome to Ask the Doc, the show where we encourage our viewers to send in their health questions. So let's kick things off with a question from one of our viewers. And today's first question comes to us through our website, allhealthtv.com, and it's from Evelyn. And Evelyn's question is, hey doc, my 15-year-old son just had his 4 wisdom teeth removed. The oral surgeon prescribed Percocet for severe pain. My boy's complaining about the pain, but I'm hesitant to give him the medication for fear of him getting addicted to it. What should I do? So, Dr. Camejo, what's the deal? Should Evelyn be worried about her son getting addicted to painkillers?
So, Evelyn, that's a great question because unfortunately, it's a typical one that we get asked all the time. But addiction is rare when you're just managing postoperative pain for a period of less than 7 days. Now, Percocet is a narcotic and it's pain relieving medication that contains both acetaminophen and oxycodone. And it can be prescribed to kids after a surgical procedure to manage, severe pain. Now, the surgeon for this type of procedure should only have given you enough for 3 days. We'll make sure that is the only thing that happens, no more than that. And my recommendation would be to start with just Tylenol first, like 500 milligrams every 6 hours the first day to see how he's tolerating the pain. If he's still complaining that the pain is severe, then begin a one-time dose of the Percocet and reevaluate the pain in 30 minutes. If it's better than the next dose, then give him Tylenol again and reevaluate pain. Only give Percocet when he's complaining of severe pain, and after giving the Percocet, if still no pain relief, then call a doctor because there may be another issue that could be brewing. So do that. And then by day 3, he should not be complaining of any severe pain. And now it's very important to dispose of any leftover Percocet by soaking them in water and soak for a few minutes, then mixing it with coffee grinds, kitty litter, and throw it in the garbage. Don't leave Percocet laying around the house. This is how other teens come and kids who can take them and misuse them. So that's one thing you always want to do is make sure you don't keep narcotics in any of your cabinets and hanging around.
That's a great point, Dr. Camejo. Thank you so much. Okay, heads up, Doc, we've got a YouTube question, and this one is from Rama. And Rama asks, hey, Dr. Camejo, my beautiful 8-year-old daughter has a sore throat, and I was just about to give her aspirin, but my equally beautiful wife was ready to kill me for even suggesting it. Why can't Surya have aspirin? Oh, Rama, that's a big no-no, right, Dr. Camejo? Dr. Rossique, please tell Rama why.
Oh, yes, Rama, thanks for reaching out to us with your good question, but I'm going to let my good friend Marie reprimand Rama. But before I do, let's check out this video from the Mayo Clinic.
So sore throats are very common, especially amongst school-age children. Some of the symptoms that a child might complain of are pain when swallowing, difficulty swallowing, refusal to eat or drink anything because it's painful. They may complain of pain on the outside of their neck where their lymph glands are. Over 90% of sore throats are caused by viruses. Those are the most common cause of sore throats. A small percentage of sore throats are caused by the group A strep or strep bacteria, and those are the ones that require treatment with antibiotics. All viral sore throats will get better on their own, and there's no benefit to taking antibiotics. And in fact, taking antibiotics for them could cause you or your child harm. So we often recommend things like cool or warm drinks, popsicles, lozenges that the child can suck on if they're old enough to do that safely can help to numb the throat a bit. Using a humidifier to humidify the air can help because dry air can be quite irritating. And then using medications like ibuprofen or acetaminophen can also help to settle some of that pain until they get better.
So Dr. Rossique?
Yes.
Go ahead.
So aspirin, which falls into the class of medication known as salicylates, is not recommended in children less than 18 years of age due to the association with Rice syndrome, which can occur in children, especially if they have a viral infection or illness. Rice syndrome is a very serious complication and condition that causes swelling of the liver and the brain. And it's very important to note that aspirin and salicylates may also be ingredients in some over-the-counter medications like Pepto-Bismol. So therefore, it's important to review ingredients before giving your child any over-the-counter medication and ask your pharmacist or doctor if you have any questions. Very important, never give aspirin or salicylate containing medications to your child for pain. Only give acetaminophen or ibuprofen.
Thank you, Dr. Rossique. So we got another allhealthtv.com question. I love this. It's from Lulu, who asks, hello, Dr. Camejo. My 7-year-old son, Wesley, has a very bad cough that's non-responsive to any of the over-the-counter cough meds. Should I call our pediatrician and ask her to prescribe cough syrup with codeine, which has helped us greatly in the past? Now, what do you think, Doc? A little cough syrup with codeine cocktail for the kids, is this okay?
So, hi, Lulu. That's a good question and that you're asking, and thanks for reaching out. But the FDA has restricted the use of prescription cough and cold medications containing opioids like codeines to adults only. So, and the reason is because children can experience severe side effects to codeine, such as low or difficult breathing, even at the most appropriate doses. So try to give Robitussin DM first if the cough has not responded to over-the-counter. Then talk to your pharmacist to see what they would recommend. Maybe the cough syrup you're giving doesn't contain dextromethorphan, which usually helps for cough. And if that doesn't work, always call your pediatrician for advice.
Thank you, Dr. Camejo. Now, in case you missed it the first time, here's my friendly and daily reminder. Another opportunity where you can send in your question is coming through. Check it out.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
And remember to send in those questions for Ask the Doc. Now, we have one question from Paulita, and she is our first Instagram question of the day. Hola, Dr. Camejo, mi bambina Pilar is teething and miserable. I have Orajel at home. Can I rub a small amount on her gums? Or is there something else you can suggest? We're getting some really great questions here. This is another good one. So can we do Orajel for Pilar?
That's a good question, Paulita. But let's see what we could do to make Pilar feel better. And Marie, what would you recommend?
So Orajel products may contain a local anesthetic called benzocaine. And the FDA issued a warning not to use in infants and children for teething pain, since it can lead to a rare and serious condition called methemoglobinemia that reduces the amount of oxygen in the bloodstream and can lead to even death. Similar warnings have also been issued for other topical anesthetics that may be applied to the gums, like lidocaine. Therefore, my recommendations for teething pain is to give your baby a chilled teething ring, not frozen, but chilled, and to gently rub or massage the gum with your finger. But never give Orajel or any other topical teething medication to your baby, which may harm them.
Thank you, Dr. Rossique. So we got another YouTube question. This time it's from Rennie. Rennie asks, Dr. Camejo, I've got a question for you and Dr. Rossique. Why, if my child has an ear infection, my doctor won't prescribe antibiotics? I was taking antibiotics almost every month when I was growing up. So are all antibiotics on the no-fly list right now, Dr. Camejo and Dr. Rossique? When can you give antibiotics?
So, Rennie, thanks for writing in and watching the show. But just like we talked about with the sore throat, many ear infections are caused by viruses, not bacteria. So you never want to treat a virus with an antibiotic. And the majority of these ear infections will go away without the use of any antibiotics. So give Tylenol or ibuprofen for pain and it will go away 1 or 2 days. The repeated use or misuse of antibiotics is really what leads to antibiotic resistance and failure to any future antibiotics working on those bacteria. So we try to not give antibiotics unless it is absolutely necessary and you have a bacteria infection.
Thank you, Dr. Camejo. Dr. Rossique, I have a follow-up to that, which is, when do you give antibiotics for children? Is it only for certain infections?
So you give antibiotics when the doctor suspects, after evaluating the patient, that they might have a bacterial infection. So you want to give antibiotics when you either suspect or you have a positive culture that says that you have an infection.
Like a strep or flu or something of that nature,
Right.
correct?
So you can do, your child may go to the pediatrician's office and they might actually do a swab, a rapid test, and it comes back as it's positive to strep. So you're going to start the antibiotics because you have a positive culture. Now, sometimes when you do a strep culture, if it comes back negative, let's say you do a strep test, a rapid test, and it comes back negative, the doctor will do a culture to confirm, because sometimes the rapid strep test can come out negative, but the culture comes back positive. So if the doctor feels at that point that it's highly suspicious, even though your strep test came back negative, they actually start the antibiotic and wait for your culture to come back. Sometimes the culture will come back positive.
That exact scenario is what happened with one of my children. As a parent, this question was extremely helpful. We have another question, so let's get to that. It's from Trent, and he wants to know, hi, Dr. C, what are the potential side effects of giving antibiotics to children? And can you minimize some of these side effects by giving probiotics? My wife recently got me on probiotics and kombucha, and it's definitely been helping with my digestive system. So, Doc 1 and 2, your respective thoughts on probiotics, especially for children.
So, Trent, I love this question, but I'm going to hand this one back to Dr. Rossique. This is definitely up your alley.
Okay. So the common side effects of antibiotics, which can occur in about 20% of children that go on antibiotics, usually consist of like nausea, diarrhea, stomach upsets, and rashes, and sometimes some more concerning reactions like allergic reactions. Probiotics can help with the stomach upsets and diarrhea by restoring the healthy gut flora that antibiotics can wipe out. Do not use probiotic supplements that are sold in pharmacies because they are not FDA approved and you don't know what's in them, okay? And they can sometimes lead to side effects. But instead, what I recommend is to give your child something like yogurt, which also contains healthy probiotics and can be added to their diet while they're taking the antibiotic. And I usually recommend to continue the yogurt for about 2 weeks after your child has completed the antibiotic to make sure that that healthy flora is maintained.
Dr. Rossique, what about the probiotic gummies for kids?
I don't recommend any probiotic supplements or gummies for children because they're not FDA approved. And with children, you have to be very careful because sometimes they might have ingredients in there that can cause side effects or that can lead to allergic reactions, especially there's so many kids nowadays that have allergies to foods, and you never know what you can get in those products that are not FDA approved.
Thank you, very helpful. Dr. Camejo, looks like we got another question from the gram, and it's from Vivica. Is there a link between vaccines and autism, especially those flu vaccines that have oh my gosh, Dr. Camejo, thimerosal as the preservative? Okay, I didn't know that they were still allowed to use thimerosal in vaccines, and please tell me I said that semi-correctly, Dr. Camejo.
Thimerosal.
Thimerosal.
There you go. So, Kathy, you're mostly right. There are some flu vaccines that still use it, but I'll get to that in a minute. And great question, Vivian. Thanks for writing in. But first, there is no evidence that vaccines really cause autism. The cause of autism is still not fully understood. And in 2001, thimerosal, which is a mercury-containing preservative, which was removed from all childhood vaccines. So, however, it is still contained in some of the multi-dose vials of influenza vaccines. And as a parent, when you go get your child vaccinated for the flu, ask and request for single-dose syringes when you're vaccinating because they don't contain any thimerosols.
Thank you, Dr. Camejo. Now, if you got questions, we got answers, you know the drill. And in case you missed it in the first couple of times, here's yet another chance to find out where to send in those questions.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
All right, this question is from Quentin, who reached out to us on allhealthtv.com. You should really check the website out when you get a chance because it's really chock full of great information. We have fantastic medical experts like Dr. Camejo and Dr. Rossique here to answer any questions that you might have. So let's see what Quentin wants to know. He says, our son Silas is severely allergic to peanuts and almonds. If he has an allergic reaction, when should I use the EpiPen? And are there any harmful side effects associated with using the EpiPen? So, doctor, does the EpiPen have any harmful side effects that Quentin or those who have allergies need to be worried about?
So, excellent question, Quentin, and we appreciate you writing it in. But before I answer that question, let's check out this video from the good folks at the Mayo Clinic.
Does your child have a food allergy?
How does food allergy happen is the first question.
Dr. Avni Joshi says one theory has to do with babies who have the skin condition eczema.
The food gets introduced through the skin, and that causes an aberrant immune response. So instead of the food being tolerant, you start recognizing the food as an allergen.
When that food is introduced into diets later, the babies have already developed antibodies against that food.
Kids start having itching and throat closure. If large amount is consumed, they can have vomiting, they can have head-to-toe hives, breathing difficulty, and anaphylaxis.
Anaphylaxis happens when your immune system identifies a substance such as peanuts as foreign. This triggers cells called mast cells to release chemicals that cause many symptoms, including dilated blood vessels, constricted airways, intestinal problems, and even death. For the Mayo Clinic News Network, I'm Vivian Williams.
So epinephrine should be used immediately in a severe anaphylactic reaction. That's the most important thing. Do not be afraid of using this life-saving medication, even if you're in doubt. So side effects that could be expected should be like palpitation, tremors, nausea, vomiting, but those are minimal compared to giving the medication and experience an anaphylactic reaction, which could be life-threatening. So after you give the EpiPen, you can also give an antihistamine like a Benadryl or a Zyrtec to help with the reaction as well.
Thank you, Dr. Camejo. Now, this question comes from Anissa, who reached out to us via Facebook. Our 10-year-old daughter, Faith, was just diagnosed with ADHD, and we have some concerns about potential side effects we've heard about, such as mood swings, weight loss, and disturbed sleep. And are there any cardiac issues that can result from children using ADHD medications? Faith, I've heard some of the same things about these potential side effects with ADHD meds. So let's go to Dr. Rossique for a little bit more info.
Okay, so stimulant medications like methylphenidate, which is Ritalin, or amphetamines like Adderall are first-line treatments for ADHD in children 6 years of age and greater, and should be used in combination with behavior management. For most kids, stimulants are safe and effective in treating ADHD symptoms. Stimulant medications do have side effects, some of which can affect sleeping. They can decrease appetite and cause weight loss. They can cause irritability and anxiousness or social withdrawal in some kids, and may even cause some nausea and vomiting. However, it's important to note that the majority of these symptoms occur early in treatment and are usually mild and short-lived. And they can also be managed by changing either the dose of the medication or switching to a different formulation, like either going from an immediate release formulation to a long acting, or even as simple as taking the medication on a full stomach after meals, which will relieve the nausea and vomiting that can occur. Stimulants also can increase the heart rate and blood pressure, and this is important in children that might have an underlying condition of the heart. So prior to starting treatment with these medications, it is important that your child or adolescent has a thorough cardiac evaluation. And usually your doctor may send your child to a cardiologist to do this whole review. And it is important after you start these medications to monitor your child's heart rate, blood pressure, throughout the time that your child is on these medications.
Thank you so much, Dr. Rossique. We have time for some more questions. And this one comes to us via Facebook from Gage. Hi, Dr. Rossique. Can you overload the immune system by giving multiple vaccines at the same time? Great question, Dr. Rossique.
So children's immune systems are not overwhelmed by vaccines. There are millions of children that have safely received multiple vaccine shots at the same time. The recommended CDC immunization schedule is designed to work best with a child's immune system at certain ages. So time without vaccination is time without protection against these vaccine preventable diseases. So it's important that you do not try to delay the immunization or the vaccines that are scheduled at a certain age for your child.
I'm going to put you on the spot here, Dr. Rossique. How many vaccines should children be having throughout their early years?
So if you follow, there is the CDC has an immunization schedule that has multiple vaccines that are given to children according to their age. There are some new ones that the vaccine schedule was just updated. It's usually updated every year at the beginning of the year. And we added now a new vaccine, which is for RSV prevention. So the number of vaccines that you get a year can change according to child's age and according if there's any changes in the CDC immunization schedule.
Super helpful. Thank you, Dr. Rossique. We have time for one more question, and this one comes to us from Jasmine. She asks, Dr. Camejo, will anticonvulsants affect my child's growth, development, and learning?
So Jasmine, thank you for reaching out. Now, some anticonvulsant medications can affect bone growth. The concern is especially important for children who need to take certain anti-seizure medications for many years. So it really is important to have that conversation with your doctor. If your child needs an anticonvulsant medication for more than 1 or 2 years, make sure you have that conversation with your physician, as well as to see what else can be given, or calcium or things to help with improve that bone health generation. So similarly, anticonvulsants can affect thinking, remembering things, paying attention as well. Have that conversation with the pharmacist to see which one would be the most important one that has less side effects. And it's just about how your child reacts to medication. Everybody is different, so I can't prescribe one thing or the other. It all depends on how your child's going to react to the medication.
All right, Doc, 60 seconds here. Let's do a little express recap on the importance of pediatric vaccines and anything that we have covered today. What did you want to add? Let's start with Dr. Camejo.
So I think the most important thing is do get your kids vaccinated. I think it's really important. There are so many folks that are not vaccinating their kids, and we're starting to see a lot of diseases that are really starting to creep up, especially meningitis, other things that we should be vaccinating. We all got vaccines when we were kids. So I think that's really an important lesson. Follow the CDC guidelines for vaccinations. especially for your kids. And when they go to school, remember, they get exposed to a lot of things. And if your child's not vaccinated, they can be exposed to something that could eventually lead to a health risk later on in their development.
Thank you, Dr. Camejo. 20 seconds, Dr. Rossique. Anything you want to add?
I think in terms of the vaccines or just in general?
In general, in general.
So in general, I think it's important to always know what the medications that your child is receiving, what the side effects are, what the appropriate dose is. And if you have any question, reach out to your pharmacist. We're available. We love to answer questions and help your child. And if we can't answer the question, then we will ask you also to follow up with your physician.
Thank you, Dr. Rossique. We love to ask you questions. Now, that's all the time that we have for today. I'm Kathy Buccio. Thank you for joining us, and I'll see you next time on Ask the Doc.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.